Hey, this is Sandy,
And Randy.
and we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase them all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. We have some good stories for everyone today.
Yeah, if you think that fractures, blood, and C-spine makes some good stories, then yeah.
Yeah, I think this should be the 911 edition.
AT Corner 911?
Ooh, I feel like we have a spin-off show going on now. We might be on Netflix.
Hey, emergency medicine is a huge part of what we do as athletic trainers.
That's true. Definitely.
We actually got a lot of CPR and heart-related stories, so instead of making you guys wait 2 weeks to hear those, we're bumping up our education episode, and our hero stories are going to be next week.
So, Christmas is coming early.
Yeah, 3 episodes in the span of 7 days, I think.
Man, it's like when we started the show.
Yeah, exactly. So speaking of starting, let's get started.
Nice segue. Like it.
So this first one's got lots of blood. This one's from Brynn J. She said that she had a champion diver clip the board with her head and got a laceration down to her skull.
Ooh.
She was doing a reverse pike to warm up. She didn't go out far enough, so the top of her head hit the edge of the board when she came out of her pike. She lacerated about 2 inches back from her hairline, about 6 inches across and down to the skull.
Oh, man.
I know.
That's a big gash.
Huge and also hard to manage.
Oh, for sure.
She was super lucky, all things considered. I was more worried about shock and blood loss than anything else. Yeah, because the skull bleeds a ton.
Oh, yeah, anywhere around the face.
The scalp, yeah.
Yeah, anywhere around the face and head.
She said there actually wasn't a ton of blood in the pool itself, but they still called practice early and shocked the pool to be ready to go for the next day. I mean, honestly, I'm sure the athletes, after seeing that, didn't really feel good about it.
I was going to say, probably no one wanted to do anything that day.
Yeah. I mean, luckily it wasn't like a meet, I don't think. She said she did give us some insight on the management of the laceration and how
I'm excited.
She said that it wasn't easy, which I mean, I think we got that much. So.
Oh, yeah, for sure.
She said, I tried to pull as much away from the cut as possible. It was a frontal plane cut with surprisingly clean edges.
Oh, that's nice to work with.
Yeah, thanks, diving board. I just moved the hair out of the way, almost like a part in her hair. Then I pushed the wound closed as much as I could and packed it with sterile gauze. And then I wrapped the gauze onto her head with roll gauze and power flex.
Nice.
I feel like this is like wrestling status.
Yeah, seriously. But see, my question is, at what point do you just say, I'm going to cut the hair? I just thought of that. Like, would you cut the hair? Like, if it's getting too difficult to manage?
It's so much easier with guys to cut the hair than girls.
Yeah, that's what I was thinking. Is like, I feel like that would be interesting.
It was hard keeping the wound fairly together because of the weight of her skin in her face was pulling it open. She had a slight sag in her forehead, so it took me and Coach to hold it together to get her in there for transport.
Oh, man.
Yeah. She said that Coach helped hold the skin aligned while I wrapped her up. After my arts and crafts with gauze and powerflex, we were able to let go of her. She was stable and remarkably calm, so we called the mom, and she was able to take her to the emergency department, which also saves on costs.
Oh, yeah, from
transport.
EMS, yeah.
The mom got her to the hospital easily, and they told her that they were impressed that it held like it did. They were pleased with how clean the field was and had a lot less prep work than they expected to have. See, this is why athletic trainers do what they do.
Yeah, exactly. That's why we're important.
There's so much you can do before the emergency room. She ended up with staples in her head for 2 weeks, but was able to dive at regionals with a swim cap on, just in case.
Nice.
The swim cap helped prevent the scar opening back up from breaking the water head first. You never know with that kind of velocity and surface tension.
Ooh, I never thought of that. That's true.
I know. This is kind of like genius.
I've seen a diving athlete land incorrectly in the water, and she had a huge bruise just from the water.
Where?
On her back.
Ooh, really?
Yeah.
That must have been
crazy.
A really weird way to land.
Yeah, it was. I saw the video. It wasn't a good landing.
Ow. I've always wanted to work with diving athletes. I feel like it's very close to like gymnastics.
Oh, definitely. For sure. I've been told that they're closer to gymnasts than like swim athletes. And it's a pretty good comparison.
Mm-hmm. I've worked with them once, but not like to a very high extent.
Yeah.
to finish off the story, Brynn said, anyway, this was just one of those where instinct and training kicked in, and it wasn't until later that night that it all sunk in.
Yeah, that's usually how it goes.
I think that's a perfect way to start the episode. Like, really, all of this is like instinct.
Oh, for sure.
And like, what do you know? You don't really have time. You don't have time to open up a book.
Oh, yeah.
Or ask anyone, really. Especially this next one, actually.
And this one is sent in by Anonymous. During a track and field event, we had the throws cage closed. But someone walked in and threw a practice throw between warm-ups and the first flight. The hammer ended up hitting an official right in the back of the head. Wow, we just jumped right in. That happened real quick.
Yeah.
So I ran over to her. Blood was pooling around her head while she was seizing.
Yeah, this is like getting right into it.
Oh, man. Yeah, this is just 0 to 100.
And I think this is like early on in the meet, too.
Oh, what a bad day.
Yeah.
I put gloves on and maintained cervical neutral. After the initial seizure, she regained consciousness. We put a cervical collar on, and before she went onto the board, we put a bunch of gauze down to help with the bleeding. She was transported via EMS. She was stapled ear to ear on the back of her head and had a concussion but no fracture. I'm very surprised no fracture.
I was just about to say that.
Holy moly. I mean, those hammers have just enough weight to where they can move really quick and cause a lot of damage.
Well, I was talking to the person who sent this in, and they said that this was the indoor hammer.
Oh, so like the weight throw.
Mm-hmm.
Nice.
And so if it would have been the outdoor hammer, she like easily could have died.
Oh, definitely.
I don't really know the difference between the two, but I mean, you're the expert over here, so I'll leave it up to you.
I was covered in blood for the rest of the meet. Oh, that's the worst.
Yeah, she talks a little bit more about this too.
As this happened in the beginning, one of the things that stood out most in that experience is, as I walked back into the indoor track arena that was filled because we host a rather large meet, I walked back to my station at the finish line through the crowd, and I forgot that I was covered in blood.
You should just forget that.
Yeah, right? People just kept staring at me, horrified. And I couldn't figure out why until I got back to the finish line, and my students were asking me what I was going to do with my pants. What a weird question, especially if you don't know. Like, wait, what?
Okay, honestly, I think about this all. Like, I wear rather expensive pants to work, and I think about it all the time. Like, man, what if I just got blood on, like, tons of blood on my pants?
Oh, I've made a rule with my athletes. If if they throw up, like, they can throw up on me. I really don't care. If they throw up on my shoes, they're out. They're on their own. Good luck.
Yeah, okay. That's another thing is, like, throw up versus blood.
Yeah, true. Luckily, I had my rain pants in my office and was able to change later in the meet when I remembered that.
So now, note to self, I'm going to start bringing an extra pair of pants to work.
Definitely.
You know, because I think about it all the time. I just, like, she didn't know that was going to happen that day.
So clutch on the rain pants. The athlete who threw the hammer was really distraught, of course. She didn't end up throwing hammer that night. I wasn't a part of the mental health aspect for the athlete because she was a visiting athlete.
So I thought that this was so important that she included this because, yeah, I mean, we think so much about responding, but in this case, it was inflicted by someone who we have contact with, and that's such a big part of, I mean, really, like, I don't know how I would feel if I put someone in, like, especially if I saw them seize after something that I did.
Definitely.
That's just a crazy thing. But then also you can actually go ahead, she starts talking about on their end too, not beyond the athlete.
Yeah, so on their end, there were more conversations with the coaches and meet director because we felt responsible and like it was our fault. So that's where a lot of the meetings we had after started with, trying to work on how we felt and what we could do to make sure this didn't happen again. One of the biggest things that came out of the accident was how important EAP practice is. Oh, absolutely.
Mm-hmm.
And that we were able to rewrite guidelines and safety protocols that are still in place for meets today. Before every meet, I review the EAP with the staff and AT students, and because of that and our preparation, everything went smooth. We host 4 more meets and indoor track nationals a few months after the first meet of the season. As far as the official, I saw her 2 weeks later at the next meet, and she was doing well. I was able to get to see her a few times a year at the other meets. Well, that's awesome. She was back out there after 2 weeks.
Yeah, I know. And after you go through something like that, I feel like the person, like you become connected with that person.
Oh, definitely. It's awesome that she was able to see that official again. That's awesome.
Mm-hmm. So actually, I've got a emergency story, but it was like the easiest emergency story ever.
Oh, yes. I think I remember this one.
So this was actually at a cross event, not track. So it was last year, I think. I was working all alone at a cross country, what are they called? The race?
Yeah, cross country race.
So I had, I've never worked one of these alone before. I feel like there's usually like a team.
Yeah.
But it was like a contracted event. So like I got all set up and I introduced myself to like the staff and the coaches just so like I'm the only medical professional there. And so then I remember that one of the coaches came up to me and was like, "Oh, hey, by the way, one of our athletes has a seizure after every race."
Well, that's nice that it's predictable.
And I was like, "Oh, really?" And I was like, "Okay, like I'll be prepared." And they told me like what she was wearing, her bib number, and like then like before she came over, like because like you can see the people in the cross country race.
Oh yeah.
Like as she was finishing, they're like, "Oh, here she comes." And so I this whole time I was like, this is the most prepared emergency I've ever had because like I know exactly who's going to go down. I know and they also told me like what her plan was, like how they usually manage it. And so like she had this like post seizure drink. And so like she came through the chute and then like she stopped racing, she seized. I made sure that her head was supported, like not hitting the floor or anything. And then afterward we just gave her post seizure drink and then she got up and went to recover like nothing happened.
Wow.
Honestly, like if every emergency happened like
yeah, if you were tipped off like, hey, this is gonna happen, that would be nice.
I almost felt like it was like seeing into the future.
Oh my goodness. Well, speaking of seizures and cross country races, I have a pretty great seizure experience. So this was my second year of grad school and we were hosting our conference cross country championship, right? It was going to be a warmer day than usual anyways. We actually had to move up the time that we were starting because of the weather was going to start warming up as the morning progressed. So the first ones to run were the guys. They started the meet for us, right? So whatever, the meet finishes or goes on, and so far so good. Like no one's like hurt yet, right? So then comes the finish, which is the most interesting part of a cross-country meet. So you can expect, even though it's a championship...
And this is a D1 school.
Yes. You can expect at least the people that finish in front, they're pretty good.
They're your top finishers.
So even though it's a championship and they're going all out, I tend to expect that they'll finish pretty good. They won't... I'm not worried about them overdoing it, unless, except for like someone finishing in the middle and the back. Like then I'm kind of worried about those.
Yeah, those are the ones you're concerned with.
Yeah, those are the concerning kiddos. Well, not this meet. So let me tell you, our top runner, our number one guy, finishes, right? I check him out and it looks like he looks fairly normal, like he normally does. He sometimes finishes worse than others, but he looked okay. So he goes to the water table to get his water. I think nothing of it. I head back to the chute. And all of a sudden, I hear my name. I look back, and then he's just gonna drop. So I run over, I grab him, and I lower him, and he starts having a seizure. Man, this seizure went for a while. I think
like a long time.
Yeah, I think what, minute and a half or
I think longer than that.
I can't remember.
It was a long time.
So it's me, another one of our ATs that were there that are responding to him. We had EMS on site, so
and he wasn't responding.
Yeah. So after his seizure was done, I tried calling his name. He would not respond to me. He responded a little bit to pain, like if I was really pinching, he would look, but his name he did not respond to. We call the EMS over, and now this is what made the story even better. Is this group they're a very brand new EMS squad. So when they were putting on the BVM, they were going to put it on upside down.
Oh, yeah, I remember that.
So we had to tell them, hey, guys, flip it the other way. So, right, we have the BVM ready. Finally, he starts kind of coming to, and we kind of hand them over to EMS. They're kind of doing their thing about, hey, where are we going to send them, right? What I don't know is our head athletic trainer at the time was responding to our number 2 athlete that collapsed before the finish line. So that was super.
And there was one that I was responding to, too.
I think you were helping with that one.
Or maybe when she brought him back.
Yeah, when she brought him back. So there was that. But back to our seizure athlete. He gets sent, so EMS takes him over.
EMS takes him over and leaves all of their equipment.
Oh yeah, they left their equipment. So we had to let them know, like, hey, you guys left your kid over here. We let the incoming rig that replaced them know, like, hey, your guys left a kid. He goes to the ER, right? And ER told him that it was dehydration. Which I'm very skeptical of that at that point, because it really wasn't that hot out to warrant, like, oh, it was like a dehydration kind of thing. And the seizures, like, it would have to be a high level of dehydration for the seizure.
Yeah, very high level, yeah.
So no matter what, we were going to have him follow up with our team doctor. So that Monday, we got him in to see our team physician, ordered an MRI, which I'm very surprised the ER didn't do this with a seizure.
First time seizure.
The kid's never had a seizure before. So get the MRI done. It turns out the kid had an AVM, which is an arteriovenous malformation. Essentially what that means is, I had to look this up because I had no idea, is the artery, instead of draining into capillaries where it kind of takes some of that pressure from the arteries, it goes right into a vein. Well, veins aren't able to handle the pressure of an artery. So what we think happened is,
when he was at his peak run.
Yeah. We think some blood leaked out into his brain, and that caused the seizure. The scary thing is, this is something that developed. Like, this is just how his circulatory system in his brain developed. This could have happened at any time during his run. And cross country, they travel, like, they just run on their own on these trails. And we are very grateful that it happened with us there, because that could have happened on a run, and who knows? I mean, he could
at a meet where EMS was on site, because I've never had EMS on site for a meet before.
Yeah, I mean, kudos to our conference, because that is part of the rule. Like, the protocol is either have a physician or EMS on site for our cross country championship. But yeah, no, it was definitely very interesting, and it's definitely a memorable experience.
Yeah, have you guys have any athletes who have had brain surgery? That's just crazy to me.
I know, that was wild.
And then you, like, that's not something we really deal with.
No, but I mean, it definitely goes back to what we've talked about in other episodes, is communication. That's a lot of talking to the neuro, your team doc, and there's a lot of parties involved.
Oh, yeah. And doing what's best for the patient.
Absolutely.
So next we have 3 baseball stories.
Baseball can turn ugly really quick.
Yes, very quick. And these are all, actually no, 2 of them are from baseballs themselves.
The evil baseball.
This first one's not, and of course it's not, because it's from our MVP, Nicolette.
Nicolette.
So she said, a baseball player came in after practice, throwing a full bullpen, and said he felt physically exhausted, kind of hard to breathe. He was able to do everything, sport testing, and he was very functional. But after a while, he also said that he had tightness in his chest.
See, nowadays, tightness in the chest means something totally different to me now. I immediately think COVID.
I know, I was just thinking that too.
I mean, obviously, this situation, no. But I'm just saying, anytime you hear tightness, difficulty breathing, it just becomes COVID.
It's a red flag.
It's a red flag.
For a different reason. After more evaluation, we took vitals, listened to his lungs, and it was a little raspy. However, he said he had a bit of a cold earlier in that week.
See, that too. I don't even believe kids anymore when they say, oh, I think I have a cold.
Oh, it's just a cold.
Yeah, no, it's not. It's COVID.
So anyway, we immediately referred him to the ER because we feared he may have a heart condition or pneumothorax. Also, his mom has Marfan syndrome.
Of course.
The kid ignored our recommendation and went home for about 3 hours. Of course he did.
It sounds like an athlete thing to do.
Probably playing video games, right? I think that's what she said.
Definitely on Call of Duty. Bet.
Then he had more difficulty breathing. Really? I wonder why. So then his mom took him to the ER, and they found that half of his right lung was black from the pneumothorax.
And in case you don't know, that's not normal.
No, it's not normal. So I asked her, like, I mean, his mom has Marfan syndrome. Like, is the kid also? Like, what does he look like? And she said that he's probably 6'2", but he's super skinny and barely has any muscle. And it's just crazy because he was so functional, and the only major red flags were the chest tightness and difficulty breathing. Which, I mean, honestly, if those are the only 2 red flags, that's a crazy thing, especially like right now.
Yeah.
Chest tightness and
even sounded
breathing.
like, yeah, that's another thing too. When you talk about like oscillating the lungs, like you expect to not hear anything with the pneumothorax.
But it was just raspy.
Yeah, so that's very interesting. What an interesting presentation.
Well, I'm glad they sent him.
Yeah. See, when in doubt.
Refer out.
Ooh, that was pretty good.
I'm sure I did not make that up. I'm sure I heard that somewhere.
Well, this is the first time I'm hearing it, so I'm going to give it to you.
So this next one's from Lyle D. This one is from a baseball.
Literally, it's from a baseball.
Do you want to read it?
Sure. I responded to a first baseman during ins and outs, which I'm not 100% sure what ins and outs are. I'm just assuming it's something defensively. We're working on some fielding work.
It's somewhere where there's a ball involved.
Yes, and it's getting hit at you.
Yeah.
That was
Didn't you play baseball?
I did, but like I said, I was not very good, so the terms probably have passed me up. So, the baseball had a weird hop on the infield. It tipped off the top of the player's glove into his left eyeball, which when I played, I was always terrified of that.
I'm terrified of that as an athletic trainer.
He goes to one knee holding his face. From the dugout, it looked like a nosebleed. I casually make my way over until he goes to stand up and falls flat on his face. And starts seizing.
Of course.
That really makes the walk a little faster.
That just takes things from like maybe a 3 to like a 10 real quick.
Big time. At that point, I'm sprinting.
Yep.
He becomes lucid, so I clear C-spine quickly. Get him into the athletic training room in the clubhouse. During the eval, he notes he tastes blood.
Oh, that's scary.
Since he was stable, a clubhouse attendant from the home team drove him to the ER. It didn't take too much convincing for the doc on site that he needed a CT scan.
Oh, yeah, I'd hope so.
Yeah, right? It ended up being an orbital floor fracture with associated concussion. It took 6 weeks before we returned to the diamond.
Wow. You couldn't just go out with a concussion. You had to get that fracture in there.
On the positive, at least there was plenty of time for the concussion to heal.
Yeah, actually, yeah, you're right. That just sucks.
Silver lining, baby.
Honestly, I can't imagine walking around with... Oh, do you have surgery for that probably?
You know, I think it depends on what the fracture looks like. It's the only thing I can think of. I'm not sure.
Yeah, I guess you would. I mean, the next one talks about surgery.
All right, I think we should talk about some surgery. Let's do this.
So this one's from Michael Y. This one said he was a second year as an undergrad athletic training student. I wasn't the individual that responded initially. However, the sound of the ball contact to the face sounded like a loud snap.
Ouch.
Like a large branch breaking from a tree. You know it's bad when you can hear it.
Oh, yeah, definitely. And when you can compare it to a large branch breaking from a tree. I know that sound, and for me, that's the sound of a pole from pole vault snapping, and that is terrifying.
Oh, actually, you should tell a story about the pole vault later.
Oh, yes.
So anyway, the AT immediately responded, and we immediately activated the EAP. There was nothing but absolute silence in the game. Yeah, because after that snap...
Oh, yeah, definitely.
I feel like I'm there. Like, I love all these sounds that Michael's providing for us.
Yes. It definitely feels like you're there.
You could hear the patient's mother just crying in worry. It was a very intense moment. That is a very scary moment for parents.
Oh, definitely, because, they don't know.
And I think especially, like, without any background knowledge, like, you just saw your kid get hit and hurt.
Rocked.
Yeah. That's really scary. Since the hospital was down the street from the field, I escorted the family to the hospital, and the patient's right side of their face was completely swollen. Surprisingly, he was calm, collected, and handled his injury very well. He ended up fracturing his zygomatic bone.
Ooh, bummer.
And suffering hefty damage to his sinus cavities as well. That's really scary, like, ow.
Yeah, that's a bad day, man.
Was admitted into surgery the next day and didn't hear anything back since they were the visiting team. However, I do remember the staff saying the surgery went well. It was a scary moment, no doubt. The patient honestly looked like he had a small butt on the right side of his face.
I like the emoji you put.
I mean, immediate swelling that looked like their face was ready to pop. That's crazy.
Just makes you want to drain it, right?
No. It makes me want to send him to the ER. I couldn't imagine breaking my face. Also, I couldn't...
You know what's funny is that's literally what he did.
Yeah.
He literally broke his face.
Okay, and then also note that they said he had surgery the next day, which means that for a period of time... Well, first of all, he had to sleep like this. He had to sleep with a broken face.
He's not rolling over to that side.
No. That scares me. Like, I wouldn't want to... I don't know if he was sent home. Maybe he was in the hospital, still...
Yeah, I bet they kept him.
But still, I don't know that I could feel... It would just be super surreal just even sitting around with a broken face. Like, what?
Yeah, no, that's really weird. Yeah.
So here's a basketball one.
So this one's from Christian A. An athlete went for a dunk, his feet swept away from under him, and he landed in cervical hyperflexion, and he couldn't feel his extremities. That's never a good sign.
Yeah, that's always a red flag.
I was the lead and held C-spine for about 25 minutes as EMS came.
You know, every time we hear a C-spine story, I feel like everyone holds C-spine for like a super long time. I know that I did.
Yeah, no, that's usually how it goes, for sure. Unfortunately, it was a parent that called 911 and told them it was not an emergency.
Okay,
yeah,
that's the kicker.
Once we realized that, we had another AT call again.
So, guys, when you're writing your EAPs, make sure the patients and athletes, whoever's calling, the parents,
that it is an emergency.
Make sure they know it's an emergency. That's why they're calling 911.
So at this event, we ATs weren't allowed to spine board since it was in another state, and that's the EMS's decision. Once EMS came in, I had my note taker explain to them what I saw and what we have done. Strong pulse, no sensation. And after that, they took over C-spine with a well-executed transfer.
That's always nice.
I know, that's awesome. A minute or so later, they told the athlete to get up. So, I'm not even there, and my heart just dropped a little bit.
Well, that's what happened to my kid, remember?
Yeah. He tried and made it happen, but felt weird. But that was out of my control. Heard back from the parent later that day that the kid will be in the hospital for a day or so, but no fracture. That is good. At least there's no fracture.
Mm-hmm. Yeah, I mean, even one of the C-spine kids that I had, he had no fracture, but he was out for like 3-4 weeks at least.
Yes, I remember that.
Yeah, and that one also, man, EMS told me that they only spine board for traumatic injuries, and I was like, you're telling me that this 8-year-old kid getting trucked and sandwiched in between two 12-year-old linemen, two giant guys, you're telling me that that's not traumatic?
It seems traumatic to me.
Yeah, they didn't see the way his neck turned like I did.
Yes.
Yeah. And that one, they also made him stand up.
Yeah, that's right.
But I mean, I'm glad there was no fracture.
Yeah, that's all. You would hate to see it if they were wrong.
Yeah. That's an interesting concept, like knowing the EMS protocol for another state.
And it's very important.
Mm-hmm. So we have 2 left. We have this long one. This one is actually just kind of crazy. Like, it's definitely an emergency situation, but it's like, I don't even know what happens. Like, it's kind of, yeah, why don't we just read it?
I think let's roll into it. Let's do this. All right, so this next one's by Anonymous. It was the last home game of the season for JV football. Overall, a decent game. Our JV team went undefeated this year. Yay.
Nice.
Nice, gotta love that. It's the start of the 4th quarter and everything has been relatively quiet. Shouldn't have thought that. Exactly.
That goes back to our superstition episode.
Murphy's Law. Well, a kid on the other team goes down. So I get out there and the coach from the other team joins me to help calm the kid down. He's screaming that he tore his ACL. Okay, I say. Have you torn your ACL before? The coach confirms that yes, he has before. Great. I evaluate and determine that his ACL is completely fine. And in fact, there is no actual injury. We got off the field and I'm testing him out functionally when the AD shows up in the gator to drive me back to our sideline. I'm just finishing putting the athlete's info into a healthy roster when suddenly...
This is where it gets crazy.
The AD shouts my name like bloody murder. Never heard him yell for me like that before. Yikes. He points to the visitor stand, and I can see there's somebody collapsed on the ground. I sprint over, hop the fence, and approach the guy. When I get there, a man is already tending to him. He tells me he's an off-duty police officer / parent, defers to me but stays to help manage the situation. Teamwork, which we have talked about on the show.
Mm-hmm. And Allison just talked about that last episode.
Definitely. You gotta love teamwork. Anyway, the gentleman is conscious and wanting to get up. I start by getting consent and all that jazz. A bystander tells us that he was standing at the fence and just randomly, with no warning, passes out and falls straight backwards.
Oh, man.
I ask him his name, and here's where it gets weird. He gives me the same name of the kid who I just put into the healthy roster. I say, "What? Did you say blank?" And the cop is like, "Yeah, that's his kid out there that you were helping." I think the next words I kind of whisper out of the side of my mouth were something like, "What the heck? That's freaking weird. Of all people, I have to leave the kid I'm working with on the field and tend to his parent."
Like father, like son.
Definitely. The chip doesn't far too, or the what's the saying?
The apple doesn't fall
too far.
The apple
doesn't fall too far from the tree. That's definitely very true. A chip off the old block. That's what I was thinking.
I was like, what chip falls from a tree?
You know. Tostitos. I don't know. Whatever. So I clear C-spine, and he is denying any pre-existing medical condition, denying any alcohol or drug consumption, denying any concussion symptoms, and there are no injuries to the scalp or skull. A parent gets his kid to come over from the field to help answer questions on his medical history. Literally nothing but completely random seeming syncope that has never happened before. But he does not pass Pearl test.
Oh, that's crazy.
I know, interesting. Eyes are super dilated and not reactive to light at all. By this point, he is embarrassed and won't let us call an ambulance. I indicate to another parent that I do not advise that he drive himself home and that he should immediately go to the ER. So yeah, after all that, my AD does finally drive me over to the home sideline. He calls the AD from the visiting school to inform him of the incident. After he gets off the phone, he comes over and is like, "Do you know who that guy was?" I say, "Nope, just that his name is blank." Well, my AD then proceeds to tell me that was the son and the grandson of so-and-so, a very well-known person in the state. Hopefully he is okay, and this doesn't end up on the news. P.S. It didn't. Whew. Glad when that game was over.
Okay, so she responded not only to the kid, but to the dad, and then found out that it's a famous person's son and grandson.
So fun. It made it so much more fun.
And he didn't pass the Pearl test. That's just insane because, like, I've had someone who was having trouble swallowing, but I think that's the only, like, cranial nerve that I've seen compromised.
That one's very interesting. I've never seen that.
Yeah, that was a third C-spine situation.
Interesting. I've had eyes. I get eyes a lot.
Really?
Oh, yeah.
Like pearl eyes?
Yeah.
Oh, interesting. I've never had that. Yeah, no, I think it was just, as far as compromised, I think it was just the trouble swallowing.
Interesting.
Other than, like...
I feel like that's a really difficult one that you wouldn't think of seeing. That's cool.
Well, and the thing that, like, that it was interesting about it was she was talking, and she had to, like, pause while talking so she could... It was just taking... Like, she could swallow, but it was just taking her, like, a really long time.
That's weird.
And so it wasn't something that she had said, but we were like, hey, like, we noticed that you're having, like, troubles talking. Is it because you're having trouble swallowing? She's like, yeah, it's really, really tough to swallow.
Interesting.
Mm-hmm. Yeah. And that was a performer.
Oh, yeah, that's right.
Mm-hmm. Crazy. And then also... I've had someone who had a stroke who was just completely like the babble talk. Like that was just crazy
to see
in real life. Nothing prepares you for that.
Oh, no, not at all.
Yeah. So we have one more story to finish it off. And this is a really short one. I thought it was really cute and fun. Not for the kid.
Well, I don't think any of these are fun for the patients.
So this is also anonymous. The person who sent this in said, one time one of my classmates, my athletic training classmates, was clearly in denial about going to the hospital for his abdominal pain because he didn't want to miss class.
That definitely does sound like an AT.
Yeah, really.
For sure.
Mm-hmm. With all the signs pointing towards appendix, we finally convinced him to go during class.
Was it the appendix?
Yep. She doesn't remember if he got it out or not, but I was like, hey, you don't have to respond to injuries or emergencies just in the clinic.
That's very true.
Especially athletic training students. Come on, we are worse patients, right?
I think athletic trainers in general are terrible at taking care of themselves.
Yeah, we need to change that, guys. So anyway, we'll just finish this up super quick. If this episode makes you remember a story, which actually we get a lot of people who email us afterward and we're like, oh, hey, like I totally remembered a story. You guys, share it in our Facebook group. And if you're not a part of our Facebook group, then head over to facebook.com/group/AT-Corner-podcast, or you can look up on Facebook AT Corner Community. And then you can join the community. You can see the stories that people share. You can share pictures. You can share whatever you want. And then we also post episode discussions or episode threads so that you can comment on this episode. And then remember that every other episode is education or stories. So this one was a story episode. And because we want next week to also be a story episode, we're pushing up our education episode. So we're giving you 2 episodes this week. So on Wednesday, we'll have our interview with Scott.
Yes, that was a fun one.
So this one, we're actually talking to him about expectations of students, of athletic training students. However, I will put a great positive disclaimer on it that it's not just for students. It's actually great for students and preceptors because Scott is a great preceptor.
Absolutely. And the tips he gave out are awesome. Like, I took plenty of notes. I can't wait to apply them for when we have athletic training students.
Especially on like communication and conflict resolution. Like, those are huge things that he talks about.
I think the biggest thing to remind everyone is it's not easy being a preceptor.
No.
It is. You don't get paid extra for it. It's a volunteer role.
Maybe you get a gold star sticker if you're lucky.
Yeah, seriously. So just keep that in mind that we respect preceptors and it's not an easy job.
Nope. So you guys as always, you can check our Instagram stories for upcoming stories. We try to put up polls for you guys to answer questions so we can kind of pick your brains and figure out what stories we can get from you guys. Some of our upcoming stories are favorite gifts or ways that you've been thanked as an AT. We want to do that for December. And then also we'll probably tack on some goals or resolutions we have for the new year. And then we're pushing back being first time certified probably for the first thing of next year.
Which I think that works out time-wise.
Yeah, I think so too. And if you want to send in your story, you can to atcorners@gmail.com, or you can find us on Instagram at atcornerpodcast. Do you have anything else to add, Randy?
Nope, that's perfect. Thank you for helping us showcase athletic training behind the tape.